Mhm.
Hello, everyone. Welcome back to my channel. Today, I have a guest with me who's also my friend. This is Anjali, and she lives here in Queretaro. Today, I thought I will ask her questions because I always have my female subscribers asking me about the pregnancy and about the doctors here and many other things. So, usually, I have male guests in my channel, but this is the first time I have a female guest, and I'm sure she will answer most of your questions relating job or relating pregnancy or delivery here in Mexico. Okay, so we will uh, go straight away to Anjali, tell us about yourself.
Hi everyone, I am Anjali. I am working as a dentist here in university. It's called CSO, and I have been living here, Mexico, in Querétaro for almost 4 years. And yeah, right now, currently, I'm working as a dentist.
Yes, she's a Indian dentist. So in case anybody is looking for an Indian dentist, you can contact her. I'll give the details in the description. And Anjali, you came here because your husband first moved here for his job, right? After that, you came.
Yes,
Okay.
yeah. He came here first, and after 2 years, I came here.
Okay. So was it difficult for you to find a job after you moved here?
Definitely yes,
Mm-hmm.
because since it's Mexico, the first challenge which I faced was the language Spanish.
True.
Definitely, you should know Spanish when you're moving to Mexico.
Mm-hmm.
Another one, to find a work, you need to have the work permit.
Okay.
So before I was working as a dentist, I actually worked in a department, human resource department.
Okay.
So that company gave me the work permit, and because of which I could start working. Because with the temporary residence permit, you won't be able to work here. You should need the work permit. And regarding my profession, yeah, it is a health field. When I came to Mexico, I did not know what to do, where to apply, nothing. But I was luckily, I got a neighbor.
Mm-hmm.
His name is Dr. Alberto Pastrana,
Mm-hmm.
and he was a director, the innovation in the University of Autónoma Querétaro.
Ah.
So with the help of him, he told me like step by step where you need to do the revalidation, where you need to apply for the registration, everything. He helped me a lot.
Mm-hmm.
Also, with his recommendation only, I joined in university
Okay.
as a teacher there,
Mm-hmm.
and that's how I came up with this dentist. So it was really challenging because one more thing is, if you search in the Google from India,
Mm-hmm.
you won't be finding any government related sites or nothing.
Mm-hmm.
Only once you reach here, then only you will be able to find what needs to be done. I have done the revalidation from my plus two,
Okay.
revalidation from plus two, my BDS degree, then regarding my post graduation, and only that I could apply for my Cedula professional. That is the similar to your dental registration.
Hmm. Okay. So, like, I do get many questions asking, how do I find a job here in Mexico? So you're saying that it's not easy. They have to
It
come
is,
here, get a work
yeah,
permit. Mm-hmm.
yeah. The first thing is you need to have a work permit. That is,
Mm-hmm.
you should find a company which provides you a work permit.
Correct.
Then
Okay.
only you will be able to work.
And all your education certificates have to be changed.
Yes, everything was first you need to convert all my certificates. You need to have the translated version, and
Hmm.
after that, you have to apply for the revalidation.
Okay. And did you study anything again after coming here?
Uh, yeah, and during that time, no, but currently I'm doing my again specialization in cirugía bucal y implantology.
Okay.
So for also for you, if you need to study also, you need to have all your degrees revalidated.
Mm-hmm.
And currently, I am doing like here. The advantage here is you can work,
Okay.
and you can study.
Study.
So that is one advantage here. So right now, I am working as well as I am doing my specialization in this.
And that is in Spanish, right? All the topics?
Yes, it is in Spanish. I
Okay.
have, I'll tell you that I'm not like 100% fluent,
Mm-hmm.
but right now I can manage
Okay.
because you need to speak to the patients in Spanish.
Okay, but
So
is there an option of doing the exam in English? This is something most of my subscribers ask me. There is no option to do the exam
there
in.
is no option, no.
Okay.
I think in case of government university for like Universidad Autónoma Querétaro,
Mm-hmm.
there you need to have an exam in English.
Okay.
I don't remember exactly. It is like TOEFL or some other one exam,
Okay.
but there is an equivalent exam in Spanish also. So you need to know both the
Both the
language. It is
language.
not like English alone. No.
Perfect. Okay. All right. And when you came here, you came with your son. How old was he?
He was 3.5 years old.
Okay. How did you find, like, after bringing him here, was it difficult for him to get along with other kids and get along in school? How is it?
Actually, I don't know. I was lucky or not. It was during the time of the COVID.
Okay.
So actually, my son did not study like Anganwadi or the initial preschool. He did not do.
In India, he
And
did not
we,
go.
no,
Mm.
here you have like kinder one, kinder two, kinder three, like that.
Correct.
So he did not go for the kinder one. He
Mm-hmm.
directly joined kinder two.
Okay.
And that was during the time where it was COVID and it was the classes were in online. So
Okay.
it actually helped me a lot because I put him in school as a bilingual school.
Okay.
So they have both the sessions, like the same topics will be covered in English as well as the Spanish.
Spanish.
So it was advantage for me also that I could sit near him and I could help him what exactly they are telling us to do. And
Correct.
that was there only for 6 months.
Mm-hmm.
But after that, he had to go to school, but he was super happy because he had new friends. So I did not have much problem in that.
Okay. So it's easy for the kids to get along, right?
Yeah, yeah,
Okay.
yes. Actually, my son was really, really happy.
In the school here. Okay.
Uh-huh.
And then after some time, you got pregnant.
Yes.
Okay.
Uh-huh.
How old is your baby now?
Now she is this 30, March 30, she's completing her 2 years.
2 years. Okay. So she's growing. All right.
Uh-huh.
So my first question is, how was it? I mean, how did you decide to get pregnant? I mean, pregnant here in Mexico, not get pregnant, but here in Mexico. Was it like a decision that you both took, or?
Actually, I don't know. The thing was, one thing is we had the insurance only here.
Okay.
So that is the main thing that I decided
To
to
continue here.
make the delivery here in Mexico.
Mhm.
Another thing was I had a career break for like 1 or 2 years. Again,
Correct.
I did not want to go for that because I actually struggle a little bit to get a work here.
Correct.
So that
You
could be
didn't
the
want to
two
stop
reasons.
that.
Mainly one is insurance.
Okay. Okay. So, did you have insurance with the private hospital or the IMSS, the public hospital?
Actually, the insurance was covered by my husband. He,
Okay.
with the industry that he has for the private hospital, also there is an insurance.
Okay.
But since I've already told I was working, so if you need to get your pay after the delivery for 3 months, if you want to get the pay, you
Mhm.
need to get it registered in the IMSS. So I had both. Like
Okay.
after the pregnancy, I consulted the IMSS so that they have a record of it. And
Okay.
but all my delivery, everything consultation was done in a private hospital.
Private. Okay. All right. And was it difficult for you to communicate with your gynecologist because I think.
Yes, my doctor, I can talk about her. I got the reference from my husband's colleague.
Okay.
And this doctor, her name was Dr. Mari Pass.
Mm-hmm.
And she is an excellent doctor. She has, like, I think more than 30 years of experience in gynecology.
Wow.
I
Okay.
had difficulty in talking to her because she doesn't know like English,
Oh.
but I could manage. But she is a super like the doctors. I feel like she's like a doctor which we see in India
Okay.
because she did not prescribe me too much of medicine. Nothing. She just told me this, only this, and you go for your like the food. From the
Okay.
food, you get all the nutrients. So I'm super happy with the doctor. That
Okay.
she is very good. also the one she referred for the ultrasound scanning, that doctor also, he was also, I think, more than 30 years of experience.
Okay.
His name is Dr. Fernando Salman,
Mm-hmm.
and he is also very good. So I was super happy with the doctors.
And your doctor was from Star Medica, or which hospital was she practicing?
No, she actually from San Jose Hospital, San Jose.
Okay.
But she there was a connection. Like if you want to, my delivery was in Hospital Muscati. So
Okay.
I asked her if she can come. She said there is no problem. So she
Okay.
came to Hospital
So they're
Muscati,
very
and
flexible about all that.
yeah. Mhm.
Okay. And even if they don't speak the language, I think here people are, they take that effort to make you understand, right? With
Yes,
asking
yes, and
difficult
the that is one difference what you see here. Like here, the consultation is not like what do you say, 10 or 15 minutes. All
yeah.
the consultation will be like 1 hour,
Okay.
and like if you, and it is on time. Like when
Okay.
you reach on time, there won't be any rush. They will
Mm.
make you enter, and they gives a, every time you visit, they gives us a detailed consultation, or they take the detailed history every time.
Okay. And after the delivery, you were going to IMS for vaccination, or why did you consult?
uh, yes, vaccination, yes, because I know the vaccination there, they don't charge you anything. So
Okay.
all my daughter's vaccination was done in IMS,
Hmm.
and also in Secretaria de Salud.
Okay.
There was one in there are so many, but we went to one in La Cañada, and
Okay.
there was option for taking test also. Like
Okay.
immediately after the birth, you need to go for a few tests,
Hmm.
so that they does.
Okay.
So
So, what is the procedure in IMS tiring? Because I sometimes hear that waiting for the doctor in IMS is takes a lot of time, or getting an appointment takes a lot of time.
the for the other consultations, yes, it takes time.
Okay.
But for if it is like a pregnant ladies or for the vaccination, you can
Mm-hmm.
actually directly enter unless
Oh.
there is any other like a child waiting.
Okay.
Other than that, we can enter, because for the other consultation, yes, you need to
Prior.
like yeah, there are two options, like one in the morning and in the afternoon. So
Okay.
you need to place the card there, and
Mm.
then they take, and then only we can go.
Okay.
That is the procedure. But
Okay.
for like if it is a pregnant lady or vaccination, no
Definitely.
need to wait too much.
Perfect. That's good. Okay. And what are the challenges that you faced like after the delivery? Did you have any post-pregnancy problem? Like in India, we have post-delivery, sorry, not pregnancy, post-delivery. We have so many cares that our parents, our moms give us, no? So did you have anything like that after coming here? Did you have your parents here?
Yes,
Okay.
I was lucky that my parents were here during my delivery. So
Okay.
I did not face much problem.
Mm-hmm.
But still, I missed that, what do you say, after the delivery, you have all the treatments, no? That I really miss.
The
Only
Ayurvedic
that is
treatment
the
we
thing.
take in India, no? Yeah.
Yeah, that hot water bath, everything that I miss
So you couldn't
too
have that
much.
here.
Yeah, that I didn't have. Actually, my mom also, because you need all that medicines, no?
Correct.
So
Yeah.
that was not available here. So only thing, that is the only thing that I miss. Other than that, because my parents were here, so
You
it
didn't
was
have.
not much difficult for me.
Okay. Was it a normal delivery or a C-section?
No, it was a C-section
Yeah.
because the my first baby was also a C-section. So the doctor told me it would be better if you go for a C-section.
Okay. And how was it in the hospital? Did you have any issues with the delivery, or how was the
Mm,
treatment overall?
no, the deliver. That is one another thing. In the hospital here in delivery, you can the husband can enter.
Yeah.
So that is
So your
one
husband also
thing.
went through all whatever.
Yeah, my husband also went through all this.
Uh-huh.
Yeah, it was. I did not have much problem
Okay.
during the delivery, because, as I told, the doctor was very good. So in the hospital, I had many of the other junior doctors. They
Mm-hmm.
speak English,
Okay. That helps.
so that was not much a problem for me.
Perfect.
All
Okay.
the nurse as well as the junior doctors, they had talked to me in English. So
Okay. Okay, let me just look at the questions. Okay, so are there any benefits for having a second kid here in Mexico? Do you think it's a good thing?
Um, if you're planning to continue here, yes.
Mm-hmm.
Also, I think my daughter, we made her Mexican passport. You have both the options. You can make either Indian passport or the Mexican passport.
Okay.
But we did the Mexican passport. I think there are like few countries you can visit
Mm-hmm.
with this passport.
Mexican
That is
passport.
the one advantage what I feel.
Okay. So do you have difficulty when you did you visit India with your second kid?
Yes,
Okay.
we made her an OCI card
Okay.
that
With that.
we made her Mexican passport, but with the OCI card from Indian Embassy.
Yeah.
So that's
You
it.
didn't have any problem getting the OCI card and all, right? Is it a long
No,
process?
the Indian Embassy, they people are very helpful. Like,
Okay.
so no, I did not have any problem. Only thing was I had to visit the embassy with my child. That's it. It
Okay.
wasn't only that was the issue.
Perfect. Okay. And where are you currently practicing?
Currently, right now, as I've told, I'm doing my post graduation. So in the same institute, currently I'm working. It is
Okay.
CSO, and it is in El Pueblito.
Lovely. Okay. Perfect. So you have no problem if I give your contact number in the
No,
description.
no, no, no. Actually, I'm doing like for the Indians, it is better to do the practice in Sunday. So if anybody like if they will do, I actually have a clinic in Centro Sur also. So Sundays in Centro Sur and the rest of the days here.
Okay, perfect. And during the pregnancy or during your delivery time, did you have this fear that because your husband was working here, but what if they had asked you to go back, or in future if you have to go back? Did you think about all these? Because the people who get pregnant here, these are the questions that run in their mind. No, what if I have to go back in middle of pregnancy or after the delivery? So did you have that fear, or you thought we are going to settle here in Mexico?
No, I did not have that fear only because my husband got the permanent residence.
Okay. So you
That
people
was the one.
decided to.
Yeah, that could be the reason.
Perfect.
That I did not think about. Like if you go back to India, because I don't think there would be any issue if you go back to India with
Mm-hmm.
when it has been delivered, if the kid is being delivered here.
Okay. Yeah. So after delivery, also, if there's any such thing that you have to go back, there's no issue, right?
We can go back. Because as I told, if you want to change your child's passport, there is an option.
Okay.
Like you can make an Indian passport, or there was no. You cannot make two passport at the same time,
Mm-hmm.
but you can make either India or
Yeah, because
Mexico.
India doesn't allow dual
The
citizenship.
uh-huh.
Okay. So what advice would you give to the would-be moms or ladies who are just moms? Do you have any special advice for them?
Um, Here, the thing is same like other people. I feared during my pregnancy and all, but are the doctors good enough here in Mexico?
Exactly.
Like that is one main question. Like we feel that in India all the treatments are very good,
Yeah.
but here I don't know. Luckily, maybe due to these doctors,
Mm-hmm.
you have when you have to choose good doctors like. Search for the doctors with good experience. That
Experience.
would be the best advice I would like to give them.
Mm-hmm.
Um, um, and one thing I would like to suggest is regarding the insurance that we faced.
Mm-hmm.
Actually, the insurance the company gives.
Okay.
So we had an issue in the hospital because the initially they told amount. It was around 20,000. I don't remember exactly.
Mm-hmm.
That was the amount for your delivery because mine was C-section.
Correct.
But in the final they just double the amount, and then we thought, why is it doubled?
Mm-hmm.
Then they said, if you're going through the insurance company, this is the amount.
Oh, okay.
Yes. So you have to clarify it before itself,
Mm-hmm.
what exactly the amount will be with the hospital,
Okay.
because there we faced this issue, but I was lucky. I also had the insurance,
Okay.
so that was covered. Like
Okay.
a part of it, I mean, 90 percentage my husband's, and the
Mhm.
10 percentage from my insurance. So
Okay.
that is one thing you need to be careful. Just ask the hospital exactly what is the amount, because it is
Correct. With
not only the
insurance and
hospital
without insurance.
charges.
Hmm.
There will be hospital charges, there will be the charge of the doctors, it will be separate, the
Okay.
anesthetist, the pediatrician, everything will be separate.
Separate.
So you need to clarify with the amount of the insurance.
Okay.
And to the going to be moms, here also you have all the facilities are available. The doctors are also good,
Mhm.
so no need to be worried regarding that.
Yeah.
Only we have to be very happy. That is
Yeah.
one
And
advice I have to give.
language is definitely not a barrier because they are very helpful, right?
Yes.
Hmm.
Yeah, that is you can do the translation. You can do everything right
Correct.
now.
There are
It
so
is
many apps.
available so
Correct.
many apps, everything is. But basics you need to know.
No,
Like if
correct.
you want to be in Mexico,
Then
yeah.
we need to, yeah, that's one thing that I always tell my subscribers that you have to learn Spanish if you want to live here. Even if it's 2 years, you need to know the basics of
Uh,
Spanish, to
yeah,
understand what
yes.
they're saying.
Mm-hmm.
Okay, perfect. Thank you so much, Anjali. This was a
Yeah.
very, very informative video, and I'm sure most of the ladies who have moved here as dependent, they will get an inspiration from you, and they'll now know the procedure, how to go about it. And for the moms, for the girls who want to be moms here or who want to get pregnant here, this video is going to be very useful.
Okay. Thank you, Dipti ma'am, for inviting me to your video. Thank you
Thank you
so
for
much.
coming. Thank you. Have a
Yeah.
good day. Bye.
Bye bye.